So interventions can't occur in the gen ed classroom. And I think we were kind of talking about this before, and I think this could be a tough one for some parents because many of our kids, they need a lot of interventions, and push-in does carry some perceived limitations. So I'd love for you to give us some examples of various interventions or therapies and how they can work in the gen ed classroom.
In elementary school, we are doing interventions often in gen ed classrooms anyway, or we have specific intervention times. Most schools do. And so interventions can happen in gen ed classrooms. In terms of services, if you're talking about speech, OT, PT, all of those services, majority of those services can be push-in. And it really frustrates me, to be honest, how much of those services are pulled out. And I know oftentimes as parents, we feel like it is best for our child if they get pull out services that's one-on-one. It feels special. It feels like it's the best possibility. But I can tell you, when you push it in and students can get access to what they need in the natural setting, like if the OT pushes in when they're doing some type of, they're making something in class and needing to use scissors, the OT comes in to help with cutting during a natural time where the kids are cutting, rather than pulling them out maybe during math, then they're missing math instruction to go to the OT's room to cut with scissors. It just doesn't make sense to me. And it's also really disruptive to the student's schedule oftentimes. Some pull out is great, especially if we can do it at a time that makes sense and the student's not missing anything. But if it's like pragmatic social skills goals with the speech therapist, let her meet the child at recess. That is so much better than these isolated therapy rooms where then this child has to go generalize the skill out in the world anyway.